gotta go! Hey! I'm just a dental hygienist. I don't know how to take care of you. Are you okay? Sir? Hello? Are you dead? Hello?
Bye. Hi.
Hi.
What's up? I'm your doctor, Raquel Velasquez. What's your name and date of birth?
Billy Joe, 1192.
Okay, so why are you here?
I don't know. I think I had a seizure.
You know why you're here. Okay, I see that you're depressed. What's depressing about you?
I don't know. I'm an 8th grade dropout. I don't have a job. I live in a hotel. I have to pay, but I don't have the money.
That sucks. So you're homeless, and you're an 8th grade dropout, and you have seizures, and you're depressed. Okay, well, I guess I have to listen to your heart a little bit, right? Should do that. And I should look at your eyes. Let me even put this on. I guess it goes like this, right? Okay, so you don't talk. All right, you gotta calm down. I should have a pen light or something. Okay, so you're gonna look straight. You need to calm down. I feel like you're getting so anxious for no
I
reason.
need alcohol.
Okay, so I have something to do right now. So I saw your name's Billy Joe, homeless, seizures, depressed. So your doctor will be with you in a minute, okay?
Good morning, Billy Joe. How are you doing today?
Good.
Good. I'm Nurse Jackie. I'm going to be educating you about one of the medications you're taking. It's paroxetine. You're going to do 20 milligrams once a day. So that's one pill once a day. And we're taking the paroxetine for your depression because we want to resolve that. And this medication is also going to help with your feelings of anxiousness as well too. Okay. So right now you have chemicals in your brain that are unbalanced, and this medication is going to help to balance them, and that's going to put you in a better mood and make you happier, all right?
Okay.
So you want to make sure you swallow the whole pill. You want to try taking it at the same time, once a day, just one pill. You don't want to chew it, you don't want to crush it, don't take it half, you want the whole thing. And you want to store it at room temperature, away from moisture, heat, and light. Store it in the safest place you can find. You also do not want to stop taking these meds. Even if you start to feel better or if you start to feel worse, you definitely want to keep taking the course because this medication can take anywhere for 3 to 6 weeks to give you the full therapeutic effect, okay?
Okay.
You also do want no use of alcohol with this medication. So we're going to help you work with that as well too. So we can't have alcohol while we're using this. You also want to use caution when you're operating heavy machinery or equipment, if you're driving, if you're riding anything. You also want to take, if you happen to miss a dose, which does happen for some people, you want to try not to, but if you miss a dose, you want to take it as soon as you remember. You skip the missed dose. If it's almost time for your next dose, just skip what you missed. You never want to double dose, okay? So if it's close to when you should need the next one, skip it, just keep going as is. So some possible undesirable effects from this medication are headache, dry mouth, insomnia, trouble sleeping, constipation, weight changes, decreased sex drive, and tremor. You will also most commonly feel dizzy and sedated. You're gonna feel sleepy, but you're gonna adapt to these symptoms within 4 to 6 weeks. You're gonna get used to these. Your body is gonna learn to adapt to these, okay? So you just need to realize that these meds are gonna take some time for you to work, so you have to stick to it. So before you wanna take them, where you're at home or you're in the hotel or whatever safe place you're staying, before you take them, you want to try to eat a small snack or a meal. Take it with a full glass of water or liquid, no alcohol. Remember, we don't take these with alcohol. You want to make sure you read the label, just double check that this is the paroxetine 20 milligrams. If you buy any over-the-counter meds, you want to definitely ask your pharmacist if there's any interaction with these, because you definitely don't want to take these with cold medicines, painkillers, any other medicine that's going to make you sleepy or dizzy. You don't want to mix with these. So you know that these are going to be working for you when you start to feel better, when your moods are better, when you're happier, when you feel like you can get up and start your day and be happy. So you need to call the doctor or come in to see us again if you're having thoughts of suicide or if any of those undesirable effects become too much to handle. Does that make sense? Any thoughts of suicide, worsening depression, you come back to us and we'll take care of you, all right? Sound good?
Hello, Mr. Joe. I'm here to teach you about your diazepam that you're going to be taking for your anxiety. Are you alright? Alright, we're just going going to go over a few things about your diazepam before you start taking it. The thing is that you need to know is you need to take this medication as prescribed, okay? So you're going to take this once a day, the same time every day.
Once a day. Same time.
Every day. And you don't want to take more than one a day because if you overdose on this drug, it can be deadly. Okay?
Okay. So only once a day.
Once a day. Alright, so after you take the drug, I need you to be very mindful when you're walking around traffic because this drug's going to make you very drowsy and it's going to make you dizzy. And so I don't want you walking anywhere near cars or operating any kind of machinery while you're taking this drug. And you can't share this medication with anyone. This medication is just for you. Okay? And then I know some of the side effects are going to be a little annoying, but you can't stop this medication suddenly. Okay?
What are the side effects?
Some of the side effects, like I mentioned, is going to make you feel drowsy, going to make you feel dizzy, and it can make you feel nauseous, but that's why it's good to take this medication. Okay? Now, if you miss a dose, you can't double up. You just gotta wait until your next scheduled dose. Okay? Because you don't want to take too much of the medicine at one time. And before you take the medication, you need to make sure you're not feeling lightheaded or you don't feel confused. Because if it gets to that point, you need to contact us, okay? Alright, and so you can't drink alcohol. Can't drink any grapefruit juice, and you can't take any other sleeping medication while you're on this medication.
What about a little bit of alcohol?
Not even a little bit, because it's going to intensify your side effects, and it's going to make you even more drowsy and more dizzy, and you don't want that. Now, I have a journal here for you to write down when you take your drug, how often you're taking your drug, and then even if you want to journal some of the side effects that you're feeling, so that you don't forget about them, and then you can bring that journal back to us if you feel any kind of the side effects and that you're not comfortable with.
So today we're going to be talking about Depakote. This med you're going to take once in the morning and once at night, one tablet and then another tablet. Okay, so this medication is to help control your seizures, so you have to take it every day. Okay? So some common side effects are lethargy. You might notice that you feel really tired and sluggish, so be careful when you're operating any machinery, doing any hard work, anything like that. Okay, another thing that you want to watch out for is nausea and vomiting. Okay, this medication is really harsh on your liver, so you want to check your skin, see if there's any yellowing, or the whites of your eyes for any yellowing. If you have any vomiting that's so bad that you can't handle it anymore, you're going to want to come back to the doctor, or any bruising that you've noticed on your body, okay? If you want to come back to the doctor.
Okay.
Another thing is for, you need to tell your doctor if you're going to use any Tylenol, or we're going to try to get you off the alcohol because these things can interact with your medication. Okay, so it can make your symptoms a little bit worse. Alright? So those are the big things about this medication. Another thing you can do to try to help with your seizures and anxiety is to integrate prayer into your lifestyle. Try to calm you down, maybe talk to God a little bit. Okay.
I'm going to be your nurse practitioner today, okay? I'm Christina Yang.
Alright.
So I understand you're here for depression and you had a seizure.
Yeah, stuff like that.
That's not good. We'll get you all ready, Rue, okay?
Okay.
All right. So I just have to give you some medicine, okay? Here is your paroxetine. You're going to take these like the nurse told you. Here's your diazepam. Take them just like the nurse told you.
It's a lot of stuff.
I know. And here's your Depakote. So take it just like the nurse said, okay? Okay. So now, these are some places that can help you, okay? So here, this is a place for you to get your free medicine because you're homeless. It's called Healthcare for the Homeless Can Help You. All right, here's the phone number. And when you call Samantha, she's the director of the program, you're going to tell her that I sent you. And she is going to hook you up with all the drugs you want, okay? So here's some information on that. This is for a place for you to go, okay? This is the Christian Center for Homeless Men, okay?
Okay.
So all of these places are on Orange Ave because you told me you live on Orange Ave, okay? So they're all super close to you so you can walk to them, okay?
Okay.
All right. So look here, it tells you, like, look, they'll give you everything you need, okay? You get a bunk bed, you get a blanket, they'll give you breakfast in the morning, okay?
Sounds good.
And if you call Joe, he's gonna hook you up with a bed. And this is super important, okay? This is AA, it's for Alcoholics Anonymous. This is at the church right across the street from where you've been hiding out, all right? So you go and look, you're gonna go under the stairs in this church, and this is the name of the director, Betty Jo. And they make a circle, and you sit in one of the circle, and you say whatever you want us to talk about for that hour, okay? And everybody will listen to you, and this will help you stop drinking, okay? Because with those meds, you really don't want to drink, all right?
Okay.
All right. Do you have any questions?
No.
Okay, well, that's it, and we're going to kick you out of here because you're perfect, okay?
I'm a classic man.